Good morning. Thank you so much for joining Forge Breast Cancer Survivor Center's coffee conversation. We are so excited this morning to have Dr. Nazma Chowdhury with us. She is going to be talking about the side effects of chemotherapy. She has quite a story to tell, but also just her profession as well. So before you actually kind of get into the topic, Dr. Chowdhury, could you kind of introduce us to you, let us know about who you are and what you do and all of the things?
Good morning, everybody. Good morning, beautiful bounties. This is my favorite word, using bounties, because we are all bounties in this world from God, and I love that word always, and I use it. So my name is Nazma, and I'm originally from Bangladesh, but I came here in 1996, not in Alabama. I came in New York, so I lived in New York for quite a while, and then came to University of Alabama, Birmingham, to doing fellowship. So I am a physician originally from Bangladesh. I was actually a pediatrician over there, but here when I came, I did PhD and masters, and two different masters and PhD to do research, because that draws me actually a lot of good attention in my brain. And I was doing Alzheimer's on Alzheimer's research started, but then lots of this research form I actually passed through by the time. Now I am working in UB Cancer Comprehensive Cancer Center as a clinical research administration over there. So follow up the quality of the research and quality of the clinical trials. So that's very in general my life, and we will talk more. If you have any question, you can ask me. I am a mom, and I have a 24 years old. So yeah, so our topic is it's a very large topic about the side effects of chemo. You have a bucket list of side effects of chemotherapy, side effects of there, but not all chemotherapy, and every individual gets the side effects differently. Like it's again, it does not that one rule fits all. No, like what I get, other person might not get that one. So, but the common side effects, I can just go through like a skim through very common side effects. But before, let's say, what is chemotherapy? Chemotherapy is the most common treatment for cancer. So this and then variability of the chemotherapy depends, and then combination of chemotherapy, it depends on the patient diagnosed with the biopsy and MRI or CT scan, and based on their status of the cancer stages. So we are not going in details on that today, because that's another big subject to discuss. So today we are going to converse. So this is not a typical presentation, so you can intervene in bit anytime, please. It is a conversation, so we are gonna be converse and exchange our thoughts and effects of the chemotherapy, what we survivor gets, in general. So the very common is everybody complain about the fatigue, very tiredness. This tiredness also varies. Somebody probably very mild, somebody's extreme tiredness. So when it is too extreme, and we definitely need to discuss with our physicians, doctors. If it is too extreme that you cannot get out of bed, you cannot move, you cannot run your daily life, definitely. But there is fatigue is a very, very common. It depends, again, its degree of fatigue is variable again. Then we get most commonly also get very like somebody can get diarrhea, dysenteries. It can, that can happen. On the nervous system, we can get burning, tingling on our limbs, mostly hands and feet. On our skin system, our skin get very dry, very looks like a paper thin, like you feel like that no matter how much moisturizer you put on there, but the skin can be very, paper-like. Things happens. Hair loss is a very, very common, and there is no telling about that. And I got my hair loss too, so I actually shaved it off, and it grew back. It grew back. I'm telling you. Yeah, no matter what is the age, I have seen like a young to old age. Yeah, the hair grew back, but it takes a little while, maybe an year or so, but you can get back some hairs. The other common side effects also on the blood system, as chemotherapy actually affects all the organs, all the system in our body, top to bottom. But the blood system, is a one vulnerable system that it kills all our blood cells, chemotherapy, especially within the first week of the therapy taken. And so anemia, it can be severe, but it could be milder form again. And then it kills our, let's say, WBC, which actually protects like an army to our body as like a giving immunity and protect our body from different kinds of infections. So people, many people can get common infections like more upper respiratory tract infections, viral infections, bacterial infections are the most common infections people can get, if the immunity is too low. Nowadays, actually, the chemotherapy treatment comes as well as with the doctors prescribe, it's called the stem cell generator. So usually that does not go too much low of our blood cells. It generates our blood cells very quickly. That's a very good remedy that, doctors prescribe nowadays. So there are other systems, let's say, I can say it can affect on the fertility. If there are young patients and young survivors, they want to have children. But nowadays, some survivors also goes different fertility treatment before, so they save their eggs for the future pregnancy. You can do that. So it varies again, every system, but it is very variable. On our brain or on our, we call chemo brain. So sometimes patient complains that they forgets or they forget their daily activities. Initially, it's not the memory totally lost, but might be the coordination and then activity can hamper initially. So it goes better. It's not that it's going to be a permanent sign. These are very short-term side effects, and there are long-term side effects. One more side effects also I have encountered, which the change the nail color. My nails, like both for my feet and toenails, toe and then fingernails, became totally charcoal black. And but as the nail grows and chemotherapy, after the chemotherapy is over, the color goes away. So you will get back the nails. Another side effect is, I think I mentioned the skin, which is very common. The other side effects is the change in your taste bud, or even the smell. So all the cells dies, so you can change your fragrance, or you're not taking, the toothpaste maybe you're using before and you cannot tolerate anymore that fragrance, or the smell of that toothpaste, or even shampoo. Like it changes like a pregnancy style. Mouth sore is very common because the cells dies inside the tongue, and then your mouth area can be very tasteless for all foods, and then sore can happen. So the remedies are actually, the doctor cannot do all these remedies, but I would say like is individual choices, having like a non-spicy food, softer or liquid soupy food, or jello. I used to have lots of jello cold. That gives me a food as well as like a cold taste is better than spicy at that moment. So I would say these are the very common side effects and short-term side effects I think everybody gets in every combination of chemo. So I can stop here and then, we can converse now, I guess.
Yes, yes. I mean, you've given a wealth of information, so thank you. I do have some
Yeah.
follow-ups too. So I know that you kind of explained a little bit about like what is chemo and like what it does. So it just basically goes in your body and kills your immune system, basically. And so kind of a couple follow-up questions about just how that works. So my first question is like, how is it administered? Like, is it via a pill? Is it via IV? Like, is it like, what is the instrument used to give chemo? Are there new instruments being developed? And then also, and I'm sorry if I'm asking too many questions at once, just tell me stop, Janida, one at a time. But also, I know we've seen and like you've communicated just the impact that it has on the reproductive system of women or individuals who are going through breast cancer. And so why necessarily does it prevent or does it make it more difficult for women to conceive, or like how does that kind of affect that since it's affecting the immune system? How does that kind of go together? And then also what is it about the treatment that kind of causes a little bit of the memory changes and just the changes that a person has physiologically, mentally? Can you kind of break those things down for us?
Yes, thank you very much. So the first thing that how let's go to the fertility one. So as I mentioned, then chemotherapy can affect all of our body system, including our reproductive system. So for the young generations, for the young survivors, they can definitely, because it can be variable side effects. It can affects on the ovary, as it is a soft cell, so that can be also dead and produce period stops. Most commonly that the period stops. Sorry, I'm gonna get this one. Sorry, I'm sorry.
Yeah.
So most commonly that our period changes. Maybe the young generations, young survivors do not get any more period, so they do not know then what is their fertile period. And how their eggs are not released because it affects the chemotherapy. As I mentioned, that chemotherapy can change the body hormone level. And so our estrogen, progesterone that is needed for our reproductive system is not having enough to go through those reproductive cycles. And that's another sign that our period stops, right? Because the hormonal balance is not there, maintained. So keeping in that mind, that can come back. But if anybody do not want to get risk that, oh, I'm not sure my ovary will be again releasing eggs and I will be pregnant, so the eggs can be saved for future pregnancy. But again, young generations, they can recover. So it can be after chemotherapy stops, the period will come back. And I have seen that patient also went for just a regular normal pregnancy. So it all varies at that age of the reproductive system. And then, sorry, what was the other question on
So the other
that?
question was about what about the chemotherapy impacts the memory and
Yes.
cognitive functioning? Like, how is all of that
So
happening?
it's a more, chemotherapy, I'm sorry, chemotherapy or cancer is individually puts a lots of stress, mental stress. Patients, I was stressful that I have cancer. That's a big word and big stress. And when I got the chemo treatment, that it kills our cells, and then our brain also get that, because it is not stopping where to go in the body. It will gonna go everywhere in the body and kill our body cells, and the regeneration takes a little time, especially for the neurons. The regeneration takes a really longer time, as well as the chemotherapy directed to, let's say, other cancers, not the breast cancer, affects more, let's say brain cancer. They are gonna be having effect more, amnesia, or their the cognitive functions, and then fatigue also affects on that. So it's kind of like a combined effect. Also, one puts on over and over on another, so it's like a combination of effects. But the chemo brain for breast cancer survivor is mostly for the long-term effect, and it comes back again. It's really the no telling that the degree of the chemo brain. Okay, and then the other question I remember you asked that the peel or IV. So
Mm.
yeah, there are both forms. Okay, there are both forms, but I had IV, and I think most common portion is IV, still IV, and there are a few immunotherapeutic agents are in the market, as a pill form. Okay, so is there other question was on that?
Yeah. One of our participants actually put in the comments a really good question, but is there have you seen any correlation, and just kind of can you speak to about muscle mass and strength loss, like as a side effect of chemotherapy? Like, is that common? And then also, as you kind of discussed a lot of these symptoms and side effects that can occur when somebody is participating in chemotherapy for their treatment, what are some things that they can kind of do to ease some of these side effects?
So let's talk about the muscle mass as again. So it's all some patient cannot eat probably a good portion of meal because of the nausea and vomiting and fatigue and tiredness and their mouth sore. So for them, they can lose weight, which is very common also that patient with cancer lose weight. Their muscle mass also gets lower volume, as well as because of not enough food is there or enough nutrition is there. So I'm not sure that I have seen any patient that shrinking of the muscle mass, but I know that people can lose weight, and that does make sense for combination of nausea, vomiting, and not enough protein based food or nutritious food to take. Who has a continuous mouth sore, they cannot have food. It's painful when you have a mouth sore. It's really painful. I had some initially also. I could not eat anything, just like a juice and soup, or even it did not feel good to have that. I had to eat like some Jello, but Jello does not have enough nutrition. If I had to continue for a month, then definitely I would feel more exhausted. My muscle mass and the lower your reduce your energy as well. So I'm sorry that I did not know about in details about the shrinking of the muscle mass, but I'm pretty sure there is. And that's probably I can look at it and then answer back later. Thank you. I appreciate. What is any other question that you asked?
Yeah, and so well, she asked about swallowing as
Oh,
well.
swallowing. Yes, it's the same thing that cells inside the mouth or our digestive tract, the cells gets killed. That's the begin with, right after the chemotherapy, and the softness of our digestive tract can affect the same way, or sore inside the digestive tract happen because it's when the first layer of mucous membrane, we call the mucous membrane, the first layer we can see is so vulnerable, so soft that it dies, and then it cannot generate as soon as possible. But when you put solid food, it can affect and have a swallowing effect, and it can be painful. So but and there might be some allergic reaction as well. I remember I had the allergic reaction right the first chemo, and I could not swallow at that moment, even not a drinking of water. So they had to do some measures, to do that. So, but allergic reaction usually can be corrected, but other swallowing effect is because of the softness and sore inside the digestive tract, which is our, mouth and then next. So yeah, the swallowing effect is painful as well. Mhm.
So what are some side effects do you think, I mean, not some side effects, but what are some recommendations that you have aside from the swallowing? And I know you mentioned some of the things that someone can do when they're having the mouth sores as a symptom, but for those other things that we've kind of already discussed, what are some things that people can do to kind of ease their symptoms? And also, my final question would be, what are the red flags? Like, when should somebody say, okay, like I can't ignore this, or I can't band-aid this, like I need to talk to my doctor about this now, so that I could, get the care that I need, but also, I need to be able to eat and sleep and function.
The home remedy, or we can do in general, I mean like a home remedy, is a more of a soothing, soft, cold, or even you can have a hot food, but I mean like warm food, but as much as you can adjust in your body. It's no telling that how much I can, the coffee drinker can tolerate probably more than I'm not a tea drinker, so I cannot tolerate actually a certain amount of heat. But softer and liquid and cold food actually ease the pain. I have seen actually my friend, actually, she was just having ice cubes to have the soothing her pain inside, sore. So, and then the doctors actually is a sometimes over the counter medication is a kind of like a blue violet. Actually, you can put it's like for the kids they used to do, like the children actually, I remember. So that also helps for the mouth sore. And if it is too extreme that you cannot tolerate any food, or you cannot even have any drinks or any, I'm pretty sure you definitely have to go to doctor, on that perspective, because uh, we need nutrition. As after the treatment, we are already exhausted and tired, and we cannot go far beyond our tiredness without having any nutritious food. We need energy, and that energy comes from food. So if that is the case, that I cannot drink milk, I cannot drink any, juice, then I believe you have to, there is a no time, but it's all individual, that what I am feeling right at that moment, what I need to do for me. So it's all, about the situation, what I am encountering. It's not a book talk that, oh, you cannot eat, go to doctor. It's very tough to say that way. It's better to that when you are not able to do your daily activities, which is you cannot sleep, you cannot, walk, inside your home, you have to be act kind of, yeah, it's tough to say that how much walking or how much active you be is all variable again, but trying is like what I did. I'm like, I walked for 10 minutes or even less than 10 minutes inside my home from this room to that room, and then again I could not go further. Then fine, I rested. And then again, I took another 10 minutes stride, and then, but being active, I would say that was my mantra, that I need to be active some way, somehow, moving my body, moving my hands. It doesn't have to be vigorous exercise at all, but those 10 minutes walk inside the home, or even 5 minutes. And if you have a garden, just go to walk to the garden, like whatever the situation you have, but you cannot go any. I'm not saying that go to the gym or go to park right away, drive away. Please do not do that, because the chemo brain initially can affect on your driving skills. So do not be that brave just to, okay, I'm gonna go to park and walk. You try inside home or your premises that is safe for you, so that actually keeps me active, and that keeps me actually going on, which is me. As I was saying, that otherwise probably I'll be very crippled, or I'll be very, bedridden. So
Yeah.
please, I know that, I request every patient that please be active as much as you can. You can do 5 minutes, that's fine. And then you take another 5 minutes later on. In a day, you can do 5 times about 5 minutes. That will give you 25 minutes. And move your hands, move your fingers, just to relax, and as well as keep active your fingers, so those are burning sensation. Not much you can do, but if you want, you can have like a little cold compress, if your fingers are burning or feet are burning. I did that sometimes, when it is too much of a burning, tingling sensation. I just put like a cold towel or a few ice cream cubes. So it is, as the home remedy for an individual person helps a long way to go than the doctors do. But when we fail for our home remedies, of course, definitely, you have to go to the doctor.
Well, thank you so much, Dr. Chowdhury. Do you have any final thoughts that you'd like to leave our viewers and listeners with?
I saw another question. Was it somebody had any question on the chat? I'm sorry.
No, it's okay. I was gonna scroll up. Oh, okay, yes. Does chemo have a side effect on excessive facial and neck hair growth afterwards? So does it change the way that your body hair grows afterwards?
Yes, yes, it does. Yeah, it can be the women can have excessive facial hair growth because of again, the hormone imbalance. If we get less estrogen, progesterone, but we can get more testosterone. Testosterone is not only for men's hormone. We also have it. Women also have it. But when it imbalances with the estrogen versus testosterone, you can see the facial hair growth. For that, I would say no home remedy, but that's the doctors needs to be measure the level of testosterone and how much estrogen. I think that's the way to go for those remedies. Like one example that I did not get excess, but I had some because my hormone, my body, my cancer was estrogen positive. Estrogen, you call the ERPR positive cancer. So I could not take any estrogen supplement because my cancer is sensitive to the estrogen. So if that is the case, it can happen that we can get some extra facial hair. But at that point, only doctor can suggest what the best for the individual person. Yes.
Well, thank you so much, Dr. Chowdhury.
You're
This has
welcome.
been wonderful. I can't wait for our next coffee conversation.